Hello everyone. Bonjour tout le monde. Hope you all are safe and having a great day. Welcome to Caribbean Focus TV. Thanks for being here with us. Friends, we have an amazing show for you today. It's November and it's in recognition of Epilepsy Awareness Month. So we'll be having a very informative panel discussion with experts in the fields. So I'll give you a second. Call somebody, grab a friend, a family member whom you know can benefit from this information. Have them sit with you to watch the video together because it promises to be explosive. Go now, come on. Now that I have your attention, I need you to subscribe to our channel. Please hit the notification bell to get all the videos because we promise you a fun and interesting experience with us every time. Here at Caribbean Focus TV, we are a diverse station. We feature news, events, cultural activities, talents, and the amazing undertakings by peoples in the Caribbean community in Georgia and the US, as well as around the globe. We are here as a stepping stone to help you reach a wider audience as we achieve our mission of providing quality television programs that positively affect the lives of people in our community. And yes, we are always looking for individuals to be on our show. I am Cindy Placid, host and correspondent for Caribbean Focus TV. I am also the author of the book When Life Stood in Silence, a powerful autobiography in poetry on loss, grief, trauma, depression, anxiety, love, and so much more. It also shows the strong will and determination to rise above trials. You can grab a copy of my book on my website, risetoprosperity.com, exlibre.com, amazon.com, and many other online stores. Thank you so much. Now, as indicated earlier, the month of November is Epilepsy Awareness Month. And today, we have three fabulous women here with us to shed light on the condition that is sometimes misunderstood and taken lightly. They are doing amazing things in the community in bringing awareness to epilepsy. We will get the expert opinion and advice on what to expect, how to recognize epilepsy, and so much more. Please help me welcome my amazing and dynamic panelists, Dr. Raquel Quarells, Dr. Fariba Vash, and Natalie Beavers. Now, a little about each individually. Starting with Raquel Quarells, PhD. Dr. Raquel Quarells is an associate professor of community health and preventive medicine at the Morehouse School of Medicine. She received her PhD in psychology from Howard University in Washington, D.C. She is also an adjunct associate professor in the Rollins School of Public Health at Emory University and a member of the Professional Advisory Board for the Epilepsy Foundation of Georgia. Dr. Quarells leads the epilepsy research team at MSN, which is Morehouse School of Medicine. She has received funding from federal and private sources for the work that she does in the epilepsy community. In 2014, funding from the Centers of Disease Control and Prevention supported the MSN and Emory research teams to examine depression and self-management in Blacks with epilepsy. This funding also supported the establishment of the Epilepsy Community Advisory Board, ECAB, in 2015. The ECAB and MSN recently hosted several virtual community programs, including the 2020-2021 Epilepsy Community Resource Service and Seizures Recognition and First Aid Certification Training. Dr. Fariba Vash. Dr. Fariba Vash is an Atlanta native. She attended Agnes Scott College for undergraduate studies. She pursued medicine and completed her residency in neurology at Emory University. She then did a fellowship in epilepsy at Vanderbilt. Dr. Vash received her master's in public health at Johns Hopkins, focusing on media communication and advocacy. She has been practicing since 2009, first in Carrollton, Georgia, and now in Noonan, Georgia. Dr. Fariba Fahidvah is a member of the Professional Advisory Board for the Epilepsy Foundation of Georgia. She is also a member of the Epilepsy Community Advisory Board since 2015 and is currently its chair. Natalie Y. Beavers. Natalie Y. Beavers is an epilepsy survivor, advocate, and founder of the Angels of Epilepsy Foundation outside of Atlanta, Georgia. She is a proud mother of her 2 sons and works very hard with interacting with many epilepsy survivors and their families, as well as spreading awareness to get more people educated and involved within the epilepsy community. Natalie was diagnosed with epilepsy at an early age, and dealt with it throughout her life. She's gone through many obstacles and challenges, including memory loss. In the summer of 2006, Natalie had a seizure while driving, and that tragic car accident changed her entire life. In 2008, the Angels of Epilepsy Inc. nonprofit charity was organized and has now helped so many survivors and families in Georgia, other states, and other countries. In 2010, she created a book entitled The Seizure Diary, which is a journal that helps survivors, parents, and caregivers of people with epilepsy. Natalie and her foundation, Angels of Epilepsy, have received 3 awards in 2017 to 2018 in recognition of their dedication to positively impact society through service. In 2019, Natalie Beavers and the Angels of Epilepsy Foundation partnered with the Epilepsy Foundation of America and has traveled to many states to share her experience and to reach out to the minorities in the epilepsy community. All of these fabulous women are members of the Epilepsy Advisory Board. So please help me welcome them. Yay! Okay, so welcome to Caribbean Focus TV, ladies. It is a pleasure to be here in your audience, and it is a much greater honor to be here discussing a topic of such importance. I am certain that your contribution today will further enlighten our viewers on epilepsy. Now, so let's get this ball rolling. Let's get it started, shall we? I have questions for each panelist. So I'm going to start with Dr. Raquel. Dr. Raquel, can you please give the audience an overall review about what epilepsy is? What are the common myths, stigmas associated with it in general? What do people think about it, and how are some treated because of their epilepsy? I understand that some people think it's from the demons or maybe it's demonic. Please enlighten the audience.
Yes, unfortunately. So epilepsy is a brain disorder that's characterized by unprovoked seizures. Unfortunately, people are confused by it, and they think that it's just a mental illness. They think that if someone is having seizures, that it's a demon in them. The misinformation around epilepsy and seizures is broad. To how you respond to someone with a seizure, not understanding the challenges that people with epilepsy have to endure. I've heard, maybe it was you, Natalie, that we've talked about it as this invisible condition because people with epilepsy don't look like they have a brain disorder. They look very normal, just like the rest of us, until you see them have a seizure. And so many people are unaware and confused as to what all it entails.
Awesome. That is amazing because, go ahead.
No, and so the stigma associated with epilepsy is really quite disturbing and unfortunate. And that because people don't understand it, then people are scared of people who have epilepsy. They're confused. They think that it's contagious. Having seizures may be contagious. And so people are scared when they find out that someone has epilepsy. And what that leads to is them being underemployed or unemployed, often being isolated because seizures are unpredictable. People with epilepsy may choose not to go out in public because not sure when they'll have a seizure and how people will respond to them having a seizure. So it's unfortunate, the stigma that's associated with epilepsy,
Yes,
and
yes.
that people don't share that they have it with their friends and with their families because of that stigma.
Yeah, I certainly understand that. I have met one or two people with seizures, and I've also heard about that demonic part of it. Yes. So thank you so much for that. The next person I have is for Dr. Fariba. Dr. Fariba, it is my understanding that epilepsy is a neurological disorder, which is your area expertise. So from a medical standpoint, please help the audience understand seizures, epilepsies, what causes them? Do they occur in one or different parts of the brain? How would you explain that?
So, so just as background, the brain is a complicated organ, and the brain is made up of millions and millions of brain cells, and those brain cells communicate with each other via electrical responses, and that normally it's a very balanced, very orderly communication. And what happens in the seizure, there's like a short circuit between the nerve cells. They're communicating. It's not balanced, it's not orderly, and so it's like a short circuit or an electrical storm in the brain, and that's what causes a seizure. A seizure now there's some seizure disorders where it starts in one part of the brain, and it might just stay in that part of the brain. Sometimes the seizure can start in one part of the brain and spread all over very quickly, or you have generalized seizures where the seizure activity starts all over the brain at the same time. As for the causes of epilepsy, there's actually a lot of people don't have a known cause. We do testing that may be normal, brain imaging, EEG, so that you do get a good number of people who don't have an obvious cause. Other causes of epilepsy is anything that can affect your brain. Stroke is very common in adults, and especially you'll find that in older adults. So older adults are at risk for epilepsy. Brain tumors, brain tumors at any age. Injuries that may happen in infancy or before birth that can cause damage to the brain and then cause epilepsy. Infections of the brain or the coverings of the brain. You might term encephalitis or meningitis. Traumatic brain injuries. So those are just a number of reasons why, and sometimes also genetic disorders can, sort of a family history of genetic disorder can cause epilepsy. So there are a number of causes for epilepsy.
Wow, that's amazing. Amazing the things that we learn, we do not know, but it's good that we are having this discussion because people are getting to know more about it. Also, my next question is for Natalie, right? So Natalie, you suffer with epilepsy. My heart goes out to you. You are a survivor, girl. You are a warrior, okay? So can you please tell everyone watching about what age were you diagnosed with epilepsy and how long have you been living with it? And what are some of the challenges that you face as a child or teen with epilepsy? How were you able to cope?
I was diagnosed with epilepsy at the age of 5, and in just a few months, I will be celebrating almost 40 years living with epilepsy. And, being diagnosed at the age of 5, that I grew up in the early 80s, and was quite for everybody today. As of today, they have the cell phones and things like that. Well, in the early 80s, they didn't have that. My friends, when I was young in elementary school and middle school, they were afraid, but they actually cared for me. They wanted to take care of me. Whether I had seizures, in elementary school, on the playground, on the school bus, in the neighborhood, they were just wanted to be there for me, wanted to assist in any kind of way. And they wanted to also know what were seizures, what was it about. Even teachers at that time, they were interested in knowing, what is this? And, doctors at that time, they just stated, hey, they just have to take this medication, it should be okay. But having a high temperature at the age of 5, my parents did take me to the hospital, and they saw scar tissue on the left temporal lobe during the MRI, and I had a scar tissue the size of a dime, and that's when I was diagnosed with epilepsy. But again, my parents and myself, we had to learn and become educated about epilepsy. At one point in my life, during going into my high school years, I did, quote unquote, at that time, grow out of seizures. They call it grow out of seizures. Even the doctors say, wow, she haven't had any episodes, so maybe she has grown out of her seizures. And they take you off of medication. But my freshman going into sophomore year in college, those seizures came back. And yeah, so it's quite strange. I've had difficulties in life, even then, I don't think I've ever been misjudged back in those days until I became older and people started to really see, okay, what is wrong with her, because they're miseducated about an illness. And it's quite difficult. Even to this day, I am still misjudged. We call it discrimination, and we spoke about that at a recent event, about how with epilepsy being an invisible illness, many of us are discriminated, whether it's on the job or whether it's trying to find work and you fill out an application and you tell someone, hey, I do have a disability, which is epilepsy. Some people may not become, become hired because of that illness. So it's a lot of ups and downs battling with epilepsy, but that's why I had to become an advocate to share my story and to just make sure that, I'm a living testimony so I can encourage so many people, that life goes on. I became a mother of 2 grown kids now. You can still live life and be happy.
Wow, your story just amazes me. When I was reading through your bio, I said, oh my gosh, this girl is a warrior. That's why I call you a warrior. So I'm gonna shift back to Dr. Fariba, right? So how can you tell that someone is having a seizure? What are some of the signs and symptoms? And are the different kinds of, I think you answered that earlier, are the different kinds of epilepsy, and what happens during a seizure? What are some of the triggers? Are there any triggers?
So seizures can present in different ways. As I said, and it depends on where the seizure comes from and if it spreads or it doesn't spread. Of course, the most common image of seizures is the generalized tonic clonic seizure. Most people describe it as a grand mal seizure, where a person will lose consciousness, they may fall to the ground, they get stiff, they jerk, usually lasts less than 5 minutes, and then they're kind of confused and out of it for some time. When you have a focal seizure, which means the seizure is coming from one part of the brain, what it looks like depends on where the seizure is coming from. For example, if it's happening in the temporal lobe, just like where Natalie's seizures seem to come from, you may have different changes in speech, changes in behavior. The person having the seizure may not be talking right, they may not understand what's going on. Or example, if you have a seizure in the frontal lobe, you may have, jerking of one side, repetitive movements. Each person's may have seizures that look differently, but the key is, there's changes in behavior, movement, or awareness. And it's usually, from each person, those seizures are usually pretty much, very similar and very stereotypical and predictable. things that can trigger seizure for someone who already has a seizure disorder. There are things that may lower the threshold for a seizure or trigger a seizure, such as stress. If they have an illness, like let's say they caught the flu or UTI, lack of sleep, missing medications, changes in hormones, such as one you might find with pregnancy. Sometimes alcohol and drugs can also trigger seizures. So those who already have it, those may be triggers for seizures in someone with already a seizure disorder.
Oh, that's pretty interesting. I gotta watch my sleep. I don't get sleep. Thank you. Okay, so yes. So now I have my other question to Dr. Raquel. Now that we understand what epilepsy is and the signs and symptoms from Dr. Fariba, can you tell us, or rather, can you tell the audience how epilepsy is treated and what they can do to assist someone who's having a seizure? What are the points that you would give the audience, to remember, the do's and the don'ts?
So we just had a Seizure First Aid training yesterday, and there are three main principles of Seizure First Aid, and simplistically put, it's stay safe side. And so that is, if someone's having a seizure, you want to make sure you stay with them throughout the seizure and through their recovery. You want to make sure that you keep them safe. So when Fariba was talking about the different types of seizures, if someone is unconscious, then you want to lay them on their side, lay them on the ground, turn them on their side to let any saliva flow from their mouth, because during the seizure, you're not swallowing. And so you don't want them to choke on anything in their mouth. Then you want to, let me see, say safe side. So the other part is that if someone is having, say, a focal seizure where they're, the absence seizure is what I'm thinking of, when they're kind of, they're unaware, they may be walking aimlessly. And so you want to make sure that they are safe. So keeping them away from stairs, keeping them away from the street, kind of gently guiding them away from danger. But what you don't want to do is you don't want to restrain someone who's having a seizure. You don't want to hold them down or try to hold them still, because that's not going to stop the seizure. And in fact, holding someone down who's having a seizure may actually make them push back against you, because they're scared and thinking that you may be trying to cause them danger, cause them harm. And so you don't want to hold them down. You just want to keep them safe. You want to make sure that and part of the reason you're staying with them is because if they're unconscious, you want to make sure that they come back to their normal state before you go and release them and leave them alone, and maybe connect them with their family member or an adult who can be there with them. You also, one of the main things is you want to time the seizure. So as soon as someone starts having a seizure in your presence, you want to make sure that you look at your watch, because if someone has a seizure that lasts longer than 5 minutes, then you want to call for emergency help. Seizures aren't supposed to last longer than 5 minutes. Generally, they're lasting less than 5 minutes, 3 minutes or less. Depending on the type of seizure, it may even be just seconds long. So you want to make sure that the seizure isn't going on for too long, and that they're not having back-to-back seizures, because when that happens, then it's becoming an emergency situation and you may want to call for help for that. The other thing that you don't want to do is put something in their mouth. I know that back in the day, we used to hear that you put something in someone's mouth if they're having a seizure to make sure that they don't swallow their tongue. Well, your tongue is it's firmly attached in your mouth. It's not going anywhere. It's not going to go down your throat. So you don't need to put anything in anyone's mouth. who's having a seizure, you never want to put anything in anyone's mouth during a seizure. The problem with that is you can harm the person who's having the seizure, maybe break a tooth or something like that, but you can also harm yourself in trying to stick something in someone's mouth who's having a seizure. So you don't want to do that. The other piece is that if someone has a seizure in water, you want to always call for help, because there's the danger of them swallowing water and getting water into their lungs. Did I miss anything, Fariba?
No, I think only putting something in their mouth, they can choke on that, and then that becomes a bigger danger. They're not going to ever choke on their tongue. And with a seizure, especially a generalized tonic-clonic seizure, people do worry about the breathing, the shallow breathing, but that's okay. It will get back to normal. So yes.
Oh, wow. I the first real encounter I think I had with a seizure was like last year. My brother died, and his girlfriend was at the funeral, and she just like fell out. And that was the first time that I saw somebody really have a seizure, and that freaked me out. And I've heard of seizures, but at that point it became really real to me. Yes.
It's a scary thing to watch. Someone have a seizure. It's very scary. It's even scary for medical personnel, seeing someone have a seizure. And so it's not unexpected that others would be scared. But what we need to do is just make people understand, help people to understand what seizures are, and then how you respond to a seizure. It's okay to be scared, but that doesn't mean you can't do something. You can't help them.
Yes. And that's why we're here, to help more people.
Yeah, and the other thing that I wanted to mention, so part of my, I don't know if you were going to ask me about this, but part of my research focuses on depression in people with epilepsy.
Yeah, well, I'm going to ask you about that. Yes, I'm going to ask you about it. Yes, but you can go ahead, I can tune up my cousin.
Because epilepsy is such a challenging condition, what we know is that almost 1 in 2, the rates of depression in people with epilepsy range up to 55%. Of people with epilepsy. That's 1 in 2 people. That's pretty high. And it's understandable because it's a challenging condition. And so when you look at the stigma of mental illness combined with epilepsy, that's a lot for a person to deal with. But what we want to do is make sure that people are able to get help, not only for their epilepsy, but also for any mental illnesses that they may have. Depression and anxiety are high in people with epilepsy, and the programs that we have and that we were doing research on was using mindfulness and some principles of cognitive behavioral therapy, teaching people these mental health skills in order to help them to address their depression. And what we found was that their depression did decrease as a result of participating in this program that was delivered by phone, because we know that people who are having seizures, who have active epilepsy, are not allowed to drive. And so transportation becomes a big problem, a challenge for them. And so this program that's offered now it's being offered through the Epilepsy Foundations of America, the affiliates across the country, Project Uplift, teaches people these skills so that they can manage the conditions that they have. We're teaching not only managing the depression, teaching these skills of mindfulness, which is practicing and being in the moment and not focusing on the negative thoughts, which is where the cognitive behavioral therapy strategies come in, changing these negative thoughts that come with depression, so that they don't spiral down into depression. And what we know is that if you can manage the depression, and then people are more likely to manage their condition better. So the self-management skills that are needed, be it taking your medication on time, getting enough sleep, these different self-management skills that can help improve their epilepsy as well as their quality of life. Those skills, by managing the depression, you can improve those self-management skills, which then improves their quality of life.
Wow, you give me a lot to think about myself. I don't want to talk too much because I know it's your panel, but I suffer with depression and PTSD. So, and sometimes I don't sleep a lot, and I have a son with autism. So it's I mean, this is hitting really close to home for me. So thank you for that. So I'm gonna go ahead. Okay, so now I'm gonna shift to my next question to Natalie. So Natalie, now we've discussed your life as a child and a teen growing up with epilepsy and some of your challenges. Now I have just one pressing question that ever since I read I just wanted to know. As an adult, and I know a mom with two amazing sons, what was the defining moment for you that changed your life living with epilepsy? What was that experience like? And how has it affected you? And what are some of the positives and negatives you have dealt with since that time?
I believe, again, becoming a mother, battling with epilepsy, I believe that was a blessing, but also, you never just think that people with epilepsy never just think that you will have like major, major challenges. And in 2006, I believe, the very, very dramatic situation that happened in my life, having a seizure while driving. I was 18, I would say 16 to 18 months seizure free. And it was just like a normal day going to work. I had a great job working at a law firm, taking my nanny and my son to, her home on Fridays where his father, would pick him up after work. And I had a seizure while driving. And it became a tragedy. And that changed my whole entire life, did a 360. So can you imagine having a normal life and then all of a sudden everything in your life changes? So that was a complete new just outlet on life. So not only battling with epilepsy, here's the depression, the post-traumatic stress disorder. And then you're also a parent on top of that. You got to think about work and employment, So it was just a lot. But, I appreciate, my parents. I appreciate the support from my siblings and just the family in general, and my church family as well, allowing me to not give up, because I actually did give up. And again, that's when my doctors advised me to see a psychiatrist, and they say you have been diagnosed with PTSD, post-traumatic stress disorder, and they said you have depression, you're battling a mental illness because of all that you've gone through. And after I've slowly started to, years went by, I said, I believe that I have to share my story because that could give me strength to help someone else. Because there are so many other people battling not only epilepsy, but a mental illness. And when I start to share my story, it opens so many doors. But not only that, it opened so many other people to say, wow, I have this. Maybe I need to see a doctor. Maybe I have a mental illness. So, again, they say you go through things in life for a reason. And now I do understand that. And that's why I just will continue to just be an advocate, not just for epilepsy, but for the mental health community, to let them know that your days, tomorrow is not promised for anyone, but while you're here on this earth today, you have to turn your negative into positive. You have to live life and be happy and be thankful and grateful for each and every day and keep going.
Definitely,
Definitely, I
can
certainly
relate to
can relate
that.
to that.
And after this
And
show, we
after
gotta
this
get
show, we gotta
together,
get together.
okay? Yeah, so I must say that was very scary to hear that you were driving and had an epilepsy while you were driving. That was really, really scary. But it's always good to have a good support system when you're going through these things. So that was really encouraging. I'm sure it's going to encourage a lot of people. So now I'm gonna redirect my question again because I have some questions for you. So go ahead, sir. So I'm going to ask Dr. Raquel. So what? I think you answered that in the last question, but I'm still gonna ask it to you anyway. What is the probability of people getting seizures and epilepsies in their lifetime? I mean, how dangerous it is, and what is the survival rate for persons with epilepsy?
So the question is, so I can tell you that in terms of the rates of developing epilepsy, I'm not sure I'm understanding the question.
So I was asking, what was the ratio of people who got epilepsy, and what's the survival rate, and how dangerous is epilepsy? I mean, what are the chances of people really surviving, the survival rate, and people who live with epilepsy?
Fariba, you want to take that one?
I mean, we
I
have
can talk about the research side of it, but
yeah, you can, if you want to start, I can finish.
okay. So what we know is the incidence rates are when people are diagnosed are highest in children and in seniors.
That's okay.
Although people are being diagnosed with epilepsy throughout their life, there are people that are being diagnosed, in their 20s, 30s, 40s, but the highest number of people are diagnosed in childhood and in older adults. And that's because what Dr. Vash was saying in terms of the causes of epilepsy, where you have the traumatic brain injury and the different things that can cause epilepsy. What we also know is that in terms of Blacks with epilepsy, which has been my research focus, is that research is showing us that Blacks have a higher lifetime prevalence of epilepsy. But there isn't as much research on Blacks with epilepsy, which is part of the reason why we were focused on Blacks with epilepsy.
Okay.
So there's that in terms of that epilepsy. You want to take the survivorship, Fariba?
I'm going to be honest with you, I don't know the numbers in terms of mortality and morbidity, but with people with epilepsy, part of it can be, depends on the cause of the epilepsy. For someone who's had a stroke, who has a brain tumor, infection. So some of the mortality in epilepsy can be related to the cause of it. Like I said, I would say a great number of people don't have an obvious cause. They don't have those brain tumors. They don't have that stroke. And we can actually protect people and avoid death by treating those people. First line of treatment is medications to help prevent seizures. If we can prevent seizures, prevent injuries, for example, injuries to oneself, like a seizure, like dislocating or fracturing bones, avoid accidents. So the first, to reduce the mortality in epilepsy, it's to go to a doctor, get evaluated, and start treatment. Medications is the first line of treatment, and the majority of the people will be well controlled with medications. There is a small percentage of people who have difficult to control seizures despite medications. And the next line of treatment could be, depends on where the seizures are coming from, the type of seizures. Some examples of alternative treatments would be surgery, implants such as the vagal nerve stimulator, RNS, deep brain stimulator, and the deep brain stimulator. So if we get the treatment started, that will help reduce mortality. There is something called SUDEP, sudden unexpected death in epilepsy. We're not exactly sure what happens that causes that. But that can, again, as the name says, it's sudden death. It's usually if you have uncontrolled seizures, then the probability of SUDEP is greater. So that's why it's very important to be evaluated by a neurologist, particularly when in epilepsy. Although general neurologists can treat epilepsy, especially for the harder to control seizures, I would be evaluated by an epileptologist. And the sooner we can get treatment and we can get those seizures under control, we can greatly reduce the mortality due to seizures and epilepsy.
And what we know is that Blacks have higher mortality due to epilepsy than the other race ethnic groups. And that's because Blacks are more likely to be treated by a general physician, a primary care physician, not a neurologist. They're not being treated by a specialist. And unfortunately, oftentimes Blacks are being treated in emergency rooms. So not by their primary care physician or by the neurologist, but only coming in through the emergency room, which is why we know that Blacks are more likely to be diagnosed in an emergency room and not with the specialist or in with their epileptologist.
Wow. That's pretty interesting. Okay, so Dr. Fariba, I still had another question for you. So, I don't know, there are many people living with epilepsy. I think you did answer. What are some of the challenges that they face? I think I heard Dr. said that Dr. Raquel said that they suffered with depression and other conditions. So, what are some of the conditions that the families are living, the individuals and the families living with epilepsy, what are some of the things they face? So what is associated with these conditions, and can new things develop from just having epilepsy and seizures?
So first of all, at least from my point of view, I see that, and it's difficult, patients need the education, they need to be, they're not, like Raquel said, they're being treated a lot of times they're being treated by their primary care doctor, and so therefore their seizures not well controlled. Sometimes even patients get misinformation from their primary care doctors. For example, I've had plenty of women who tell me, well, I was told I can't get pregnant, I can't have children. And that's wrong. If we can help control seizures, we can put women on the right medications, women can get pregnant. So misinformation, I think, is a big issue. And to be honest, we know we don't have a lot of time to sit with patients, and patients don't even know what to ask. So events and events like the Epilepsy Community Advisory Board have held, and educating patients is very important. Work is an issue, just we talked about before. I do have patients where the employers are not educated, they don't know about epilepsy, they're scared about epilepsy, and they're fearful of having an employee with epilepsy. And we need to work, and the Epilepsy Foundation in Georgia Epilepsy Foundation does have programs that we can educate employers what seizures are, what epilepsy is, and how can we support both the employer and the employee so that the employee can have gainful employment. Gainful employment will reduce the probability of depression and anxiety, just like Raquel said. Depression and anxiety is probably one of the biggest issues that I face with my patients. One, with any chronic condition, and epilepsy usually is a chronic condition, you're at risk for depression and anxiety. Then you have the stigma and the problems associated with seizures, such as they may not be able to drive, they cannot find work, they may have difficulties, being in relationships because others don't understand. That's going to increase depression and anxiety. So, and sometimes even medication treatments and side effects can cause problems. So that's an issue. And then there's also the issue that may arise from the reasons for epilepsy. People have strokes, they may have paralysis, speech issues, obviously, or brain tumors, living with a brain tumor, getting treatments. So those are some of the range of things I find from my practice in patients having problems, when they have epilepsy and the problems that they deal with. Finance is a big issue, whether they can't get insurance or they're underinsured, or they can't get insurance because they're not working. So therefore coming to the doctor is difficult. Paying for transportation to get to a doctor is difficult. They can't pay for their medications or their treatment, and that becomes very challenging. And then it ends up being this vicious cycle of not going to the ER for their care, not getting able to see a neurologist, not be able to get their medications in time. So those, from my point of view, is what I see as in my clinic, the range of issues that people with epilepsy deal with.
Oh, that's a lot. That's a lot to deal with aside from dealing with epilepsy, itself. So, excuse me. Natalie, my next question is for you. So, as a survivor, you have formed your own nonprofit organization called Angels of Epilepsy. How has your foundation been able to assist many in the state of Georgia? Is your assistant just, in understanding epilepsy limited to just the United States? Do you go to other countries and educate people about the effects of, tell them about your story and the effects of epilepsy epilepsy has had on your life? Why am I having a tongue twister? Okay.
So I started my organization in 2008, right before my final brain surgery. And the reason why I really came up with the idea to start Angels of Epilepsy was I met a lot of people. I went, I would say about maybe 9 months with a lot of brain testing and monitoring before my brain surgeries. And I met so many epilepsy survivors and families, and we had similar stories. And that's how I came up with the idea to say, wow, should I start a support group or some type of nonprofit organization? And I said, if I start a nonprofit organization, I do want to definitely give medical resources and educate people about epilepsy and seizures and, the brain. I said, but I want to do more for the community. Many people with epilepsy, it's an invisible illness. We give medical ID alert necklaces and bracelets. So if someone were to have a seizure in public, they can have a necklace or a bracelet on just to alert someone that, hey, they have epilepsy or seizure. I had a seizure in January this year. I was in the grocery store. I fell down, had a seizure, but they alerted someone on that medical ID necklace, to call for help. So again, the medical ID necklaces and bracelets we do give for free, throughout through my agency, my organization. Also, many people with epilepsy, survivors, families, it's difficult for them to pay for medical prescriptions. Some of them may not have health insurance, especially due to the pandemic now. Many parents have lost their jobs. We try our best to help providing with gift cards to give to families, parents, caregivers, and survivors, gift cards to assist them getting their medical prescriptions. And also just medical devices that they may need. Some people need humidifiers for their home, if they are an epilepsy survivors, or certain other needs for their home. We try our best to help supply for that as well. It's a lot. We have Angels of Epilepsy COVID packages where it's food and needs for the house right now that many survivors and families need for their home right now because of the pandemic. So it's a lot that our organization does. Also, visiting hospitals. Many people may not know that epilepsy survivors spend a lot of time in the hospital, especially if they are possibly seeking brain surgery. So, because I was one of them, I know about that, and they spend a lot of time in the hospital. So we provide Angels of Epilepsy gift bags and baskets to local hospitals, Emory University brain department. For those who are just being in the hospital for days, we have great gift baskets for them and their families. We give the families gift cards because they sit, and need food and coffee at Starbucks, or we help them with their parking. because they have to sit at the hospital for days. So we just try our best to just support the families and the survivors who are in need of help. So that's what we do. Everybody that says that they meet angels of epilepsy, I say, welcome to the family. So that's what
Wow.
we do. I know about epilepsy. I've been living with it for almost 40 years now. So I know all about it. I know how it feels. So that's what we do.
So I was asking, is it limited to other countries, or is it limited to the United States? Do you go out to other countries to assist people, and teaching them about epilepsy?
Oh, yes. And a lot of people, just because we are
You have to mute.
Georgia, just because we're in the state of Georgia, they say, hey, I'm in this state. Can you help us here? And I'm like, sure, we can mail this to you. But also, we have helped other survivors and families in other countries. We have helped people in Jamaica, Canada. We have sent gift baskets, a support group in Kingston, Jamaica, in the islands. Canada is what the UK is one of the other countries that we also support as well. So we're trying to reach out to some more. We definitely want to get out there in Africa. I want to actually visit Kenya because we are affiliated with the organization there. But I actually want to go out and visit Kenya over there in Africa because a lot of people don't know that there are epilepsy survivors over there, and a lot of them are children who have epilepsy in
Wow.
Kenya. So I would
That's
definitely love to go visit. I
In
am
several of the countries in Africa, actually,
yeah.
I've read some articles about some studies that are taking place about epilepsy in different countries in Africa.
Oh yes. So I would definitely love to go visit one of these days just to go and just show support, bring a whole bunch of my seizure diaries and just gifts for everyone.
that would be amazing. That would be amazing. So since we here with Dr. Raquel, thank you so much for that. For what you and your organization are doing, Natalie, is just mind blowing. How you've gone from just like having this condition, not gone from having it, but you're still living with it, and you are able to help so many people in the process. Hats off to you, lady. So, Raquel, Dr. Raquel, let me introduce you. Let me address you properly, okay? So you are leading the. You are leading the charge in the epilepsy research team at Morehouse School of Medicine. First, what was your driving force to take on such a research? I have heard reports that some people with epilepsy have been arrested by the law enforcement. Some have been unfairly judged or treated at school because of the signs are not recognized. So, what drove you to take on epilepsy? And what are some of the efforts, to educate the public about epilepsy, besides just the forums like this? And what resources do they have available?
Okay.
I know it's a lot, but do your best.
No, I don't mind. So I will tell you that Dr. Nancy Thompson, who developed the Project Uplift program that I was telling you about, that uses mindfulness and cognitive behavioral therapy strategies to help people with epilepsy to reduce their depression, she approached me about working together. I have been doing cardiovascular disease research, and I still do cardiovascular disease research, prevention and management. And she approached me about working with her with epilepsy. But the type of research that I do, I've always done community engaged research, which means that I work with people who have the condition, people who support the people who have the condition, organizations, community organizations that have the condition. And so one of the things that I definitely wanted us to do if we were going to go get into this collaboration was to create an epilepsy community advisory board. And I wanted us to have a board that of people who knew this condition more than Nancy or I, since we don't have epilepsy. And so we created the Epilepsy Community Advisory Board that had people who have epilepsy, people who treat people with epilepsy, people who support people with epilepsy, as well as community advocates. So we invited, in terms of community advocates, we invited people in the community who are very supportive of the whole epilepsy community. And that includes staff from the Epilepsy Foundation of Georgia, as well as people who have been working in the community for some time. And so the work that I do in working with the Community Advisory Board, but then also making sure what we realized when we first started was we realized that there was a lot of misinformation. We realized that people really didn't understand epilepsy in the Black community. And so it became a real passion of mine to make sure that we need to educate our community about epilepsy. And so working with the Community Advisory Board, we began to have community events in order to educate the community about epilepsy. And so each year, since the start of the board, I believe, maybe outside of the first year, when we were getting ourselves together. But every year since then, we have had community events, which is different for research because, you have the research stuff that you're doing that's separate from these community events that we really did feel that we needed to do. And it was all about empowering and educating our community about epilepsy. And so most recently, we began doing the resource series because we realized that that's what really is needed in the community are resources, making resources available, kind of like what Natalie was talking about, where she's making particular resources available to people in the epilepsy community. Our ECAB was also looking to connect with other community organizations in order to make resources available. So when we know that there's a high rate of depression and anxiety in people with epilepsy, then why not connect with an organization who specializes in that? And so we connected with the National Alliance on Mental Illness. They already have resources available for people who have a mental illness. They have support groups. And so making those connections for people who have epilepsy. In addition, we hear from people quite often about employment challenges, employment discrimination, being fired unjustly or not being hired because of their epilepsy. And so and being asked, what can I do about that? And so we connected with a law firm who does civil rights law and put on a session that talked about what are your rights as an employee? In order to empower the community. And so that's been kind of our going forward. What can we do and in order to empower the community? And one of those ways is through education. And it's really become a passion of mine to make sure that our community is empowered about how to manage their condition.
They do say knowledge is power. Oh, sorry. Oh, yeah, this mute thing. I was saying they do say that knowledge is power. So we once we can educate the public about what epilepsy really is, they are going to be able to better understand how to treat others with epilepsy. And I always applaud you for all the work you do. And I'm going like, oh, she leads it. Then okay, so I need to ask her what drove her. Yes. So Dr. Fariba, I think I'm going to ask Dr. Fariba next question. I think I asked you that question. I think you answered it briefly. I'm not sure, but who is more prone to getting epilepsy? And can somebody's diet contribute to them getting epilepsy? I think I got that question because I was doing some research. So who is more prone?
Children under the age of 2 and people over the age of 65 are the most prone. Children under the age of 2, mostly because of issues that may happen before birth or at birth, like the brain doesn't develop normally. Sometimes strokes can happen during or before birth, malformations of the brain matter. So that's why children under 2 can be at risk, a higher risk for seizures and epilepsy. And also people over the age of 65, just because diseases such as brain tumors, strokes, are they happen more in the older population, so that's why it puts older people at risk. But like we've mentioned before, epilepsy can start at any age, but those 2 groups are at higher risk. And I think I forgot the second part of the question.
I said, can the diet affect?
Oh, diet. So diet. There's no diet that would. Now there's diets that can treat epilepsy. Most notable is the ketogenic diet, where we put a person in ketosis. That's usually saved for children with very uncontrolled epilepsy, because it's so hard to maintain. It's like fats and no carbs. It's kind of like the up to dose of an Atkins diet. I don't usually necessarily recommend that because it's so hard to maintain, but sometimes that can help. But in terms of diet causing seizures or being a trigger, there of course, if one person is even someone without epilepsy, if someone's sugar goes way too high or drops, or someone's very intoxicated, or they're in alcohol withdrawal, those are the kind of things that can trigger a seizure in anyone, whether you have epilepsy or you don't have epilepsy. So those are provoking factors regardless, but there's no particular diet that would necessarily trigger, would cause epilepsy.
So how widespread? So okay. Okay. So yes. So how widespread is epilepsy? How widespread is it? I mean, how many millions of people have epilepsy?
65 million people, and 3.4 in the United States.
Oh, that's a lot.
And that includes about 500,000 children and 1 million seniors.
That's a lot. Yeah, so upon my research, because I have my son with autism, that has always been at the back of my mind. So upon research, I found that the risk of epilepsy in people with autism is very high. 23% of seizures, and most common from the ages of 9 to 12. Now, my son is 12 years old, and he has autism. So that has been at the back of my mind. So should that be a cause for concern with me as a parent with autism? Should that be a cause of concern to think that, okay, maybe sometime later that my son is going to develop, get a seizure or have epilepsy?
It's kind of hard to say. Certainly, that could be he might be at risk for a seizure, but we don't know if and when, and so 1 in 26 people will develop epilepsy. I think if there are people who have the risk factors like autism or strokes, and they never develop seizures or epilepsy. So I think chance, but I can't tell you if that's going to happen and when it's going to happen. Like, for example, I've had patients who had strokes 10 years ago. They didn't present with a seizure until like now. Why and how, I don't know. They've always been at risk for seizures because of the stroke, but they didn't develop the seizures until years later, or they may never develop seizures. So although that's certainly understandable to have that concern in the back of your mind, I think, I don't know. I mean, as a parent, it's hard not to think about that, but I wouldn't want one to be, hopefully it will never happen. And if it presents itself, then we can treat it immediately and treat it quickly.
Okay. Thank you so much. I'm on mute. Okay. Thank you so much for that. There are times that he's had episode and he's just like he gets really really like I'm like, is he having a seizure? He gets really stiff, and I don't, because I didn't know the signs of a seizure, you know. So, but I know now that discussing this with you ladies, what to look for, and maybe I could, you know, advise, you know, other people on, you know, what to look for. I have learned so much, and I know that the audience have learned a lot as well. I have just, we will be wrapping up in just a bit, but I have just one or two more questions. Natalie, as an ambassador for those living with epilepsy, what has been your greatest accomplishment in the fight with epilepsy, and what would you say to individual families with epilepsy to help them better cope with the medical condition?
I believe when I actually received the Lifetime Achievement Award with Wego Health. Wego Health is a well-known health agency that's worldwide, and I became a finalist out of almost 4,000 advocates, and that was in 2017. And I won the Wego Health Lifetime Achievement Award, and that touched my heart a lot because that was a passion that I had years ago. I said I really believe that I need to become an advocate, and by me receiving that award, that helped me so much. And what was the last part? The last question that you had, Miss Jackie?
What advice would you give to families, you know, living with epilepsy, you know, to help them better cope with the condition?
As far as I would actually say get the research, get knowledgeable about epilepsy, because get educated about it, because it's always good to know about it. When you do your research, because even with other illnesses, I just when I see something on TV, I just go and do my own research. So I just tell people to, venture out and do your own research when it comes to it. So regardless if you were to go to a doctor or ask a doctor for help, you still can actually do research too, and to just become more educated about it and join support groups. And also, so everyone is on social media now. They have a lot of support groups and advocacy groups and things like that on social media. And as far as the survivors, definitely just become part of those particular support groups as well, and get to know each other. Don't be ashamed to tell your story and to talk about the different challenges of what you've gone through, because you just don't know that you can help someone else out there, whether you're a survivor or an actual parent or caregiver, because when you speak about it, there could be just that one person that you can touch. So I tell people to just, hey, share your story, because there's someone somewhere out there that you could possibly touch.
And that's, I agree 100%. And about the research, I believe in doing research, whatever. The thing is, they asked me to write a poem, I'll do a research. My head is hurting me, I'll do yes, so anything, because research is good, that you get the, the nitty gritty of everything. So ladies, I just want to say thank you so much for being here with us to share such vital information of epilepsy. Your contribution has been so amazing, and it was a dynamic topic, and you all did an amazing job, and you all did an amazing job, and I just want to say thank you so much for being here, for everything that you have done, and so all the information that you have given to our guests. Well, again, I say thanks to our dynamic guests, Dr. Raquel Quarells, Dr. Fariba Vash, and Natalie Beavers, our epilepsy survivor. Thank you so much. It is our hope that this video can shed light on the challenges of epilepsy, help you better understand the disease, and remove some of the stigmas associated with it, and move to reach out to someone in some way to help fight the medical disease of epilepsy. Sometimes in our own space, going through our own struggles, we never take the time out to ponder over the many lives of the people who are affected by so many diseases in so many heartbreaking ways. Many of us silently suffer with our battles, all the while having a smile and still finding ways to encourage and lift others up with our own struggles. There are countless of people doing phenomenal things to add value and meaning to others' lives, but are still in the shadows. So many of us, so many of you have inspiring stories that can help change somebody's life, like you heard in the program. The world is full of negatives and lots of people have lost hope. I encourage you to let us share your story with us at Caribbean Focus TV. You can empower and inspire someone else through their struggles, or share valuable information and resources that will assist the general public. You can visit our website, caribbeanfocus.tv, to contact us, learn more about what we do. Once again, thanks so much for viewing Caribbean Focus TV. Don't forget to follow us on our different social media platforms: Instagram, Facebook, Twitter, LinkedIn. Hit the subscribe button on the YouTube channel, y'all. This is your host, Cindy Placid. Enjoy what is left of your day and remember to stay focused. This is the the month for Epilepsy Month to show awareness to it. So go out there and help someone in need. Thank you. Have an awesome day.
Caribbean Focus TV will bring